Great, thank you very much. It's a pleasure to be here, and since I'm the thing in between you and potential lunch breaks, I will hope to keep your attention for a little bit longer. So as Tom said, I'm going to talk a bit about insurance coverage for some inherited disease. So you can go to disease testing. So go to the next slide. So what I want to just do is set the groundwork a bit in the first couple parts of the roadmap to think about different types of insurance, different types of tests, different people who would be testing, because I think that's really important for us to understand who might be tested and why and when, and that has implications for insurance coverage. Then I'll talk about some trends in insurance coverage of genetic testing broadly, and I'll bring in some example insurance policies to show some of the common trends in this area, or common things to look out for in this area. And so really a lot of my talk will be broadly about insurance coverage for genetic testing, but I'll end by talking a bit more about challenges for adopted individuals who want insurance coverage for this. So next slide. Great. So of course, in order to know whether your insurance policy or a person's insurance policy will cover genetic testing, it's important, of course, to think about what type of insurance you have. So there's going to be really different coverages across different types of insurances. So whether somebody's on Medicare or Medicaid, or they have a group or individual private plan, that's really important. And here I'm going to be focusing in on private plans in general, because that's easiest to sort of pull some of the information. But if a family or individual is on one of these other plans, they of course have to look towards other places to see whether or not the policy will cover testing. And of course, it's important to keep in mind that there's a number, it varies, but maybe 10% or so of individuals who don't have any insurance. And so of course, that's going to be a gap as well, but I'm just focused on those who have insurance. Next slide. Great. It's also important to think about the type of testing that we're thinking about. So one really important difference that has been mentioned a little bit already today is differences in whether or not we're thinking about coverage for a diagnostic genetic test. So a child or adult already has symptoms of something versus preventive or predictive genetic testing. So we want to see whether or not somebody is at risk of a genetic condition in the future. For some maybe children who are adopted, I'm thinking of some of the cases that Dr. Johnson mentioned, where there's a lot of developmental delays. Maybe something like whole genome or whole exome sequencing would be needed in some of those cases. I'm not going to focus too much on that context. There is some insurance coverage for whole genome and whole exome sequencing, but not by no means universal coverage for that. So that can be harder to get to. And then of course we have carrier screening tests and pharmacogenetics and a whole bunch of other types of tests. So I'm really going to focus in on the private insurance, as I said, and then the difference between diagnostic and preventive or predictive genetic testing, and talk about some of the issues here. And then the last table setting that I want to do before digging into this is it's really important to think about who is getting testing. This came up as well. I believe in Laney's talk mentioned sort of, are we testing the child for adult onset or child onset conditions? Or are we testing an adult for adult onset conditions? And so insurance will think of these tests differently. So insurance is not likely at all to cover adult onset testing for children, because in part of the discussion that's already happened today about how it's not necessarily recommended for children to have genetic testing for adult onset conditions. So I'm going to focus in on adults. We mentioned really early on, it's important to think about the broad spectrum of individuals who are adopted, both children and also adults. So I'm going to actually focus in on adults and some of the predictive genetic testing they might need. And this also, I think, helps to address some of the questions that I saw come up in the chat, that this can also have implications for family members of individuals who are adopted who also might not know their family history, and that can have implications for insurance. with that table setting, I want to talk about some of the general trends in insurance coverage for genetic testing. So over the years, there has been increasing insurance coverage for genetic testing for inherited diseases. And again, I'm really focusing in on here, adult onset, maybe more predictive genetic testing for some conditions. And as I mentioned, we've seen more limited coverage of next generation sequencing or multi-gene panel tests. So that's where, instead of having one single genetic test for, let's say, BRCA, the predisposition of breast and ovarian cancer, you have a genetic test for lots of different cancers at once. And those are less likely to be covered by insurance than just a single monogenic genetic test. More and more insurers over time have policies that are for specific types of genetic tests. And so in order to see whether somebody is covered, you have to see whether or not that specific genetic test is covered. But despite these increasing trends towards more coverage of insurance coverage for genetic testing, there's still plenty of barriers to getting access to insurance coverage. And that's for the general population. And it's even more exacerbated, as I'll talk about in a bit, for individuals who are adopted. Next slide. Great. So I did want to point out, for those of you who are interested, there is a great resource at UCSF called Transfers, the Center for Translational and Policy Research on Precision Medicine, but they've done a lot of research on insurance coverage of genetic testing just across the board in the general population. And so I'll be highlighting some of papers that come from them, but I just wanted to let you all know that if you're interested in this topic, they have a whole list of publications, and they've done sort of reviews of insurance coverage policies from everything from whole genome or whole exome sequencing to some of the examples, more specific examples I'll go into. So next slide. So what I'm going to do is I want to give an example of two different types of really specific trends. So I'll talk about one paper about BRCA, breast and ovarian cancer testing, and then one for Alzheimer's, because I want to show sort of the range of types of policy coverage that's out there. So next slide. This is a review that was done in 2015, so things may have changed a bit, but this just gives an overview of insurance coverage. So in this paper by Klein et al., they reviewed 17 policies from 20 of the largest private insurers, and 14 of those insurers had coverage policies specific to BRCA 1 and 2 testing, and they did provide coverage for BRCA 1 and 2 testing. I'll make a note of this later on, but it's important to know that just because they have coverage for that in their policy doesn't mean that every individual can get access to that coverage. You still need to meet the testing criteria within the policy, but you can see that 14 payers had a policy on the books that said, if you meet these criteria, we will pay for BRCA 1 and 2 testing. Back in 2015, as I mentioned, they found that there was minimal to no coverage of panel tests, meaning looking at multiple genes at once, multiple types of cancer risk at once. So really focused in on just BRCA 1 and 2 testing here. So next, yeah. So in contrast, we can look at a really recent study by Jelaine Arias et al. From 2021 that looked at payer coverage for APOE, which is predisposition to Alzheimer's disease. So they reviewed the 8 largest private insurers, so not the same crop of insurers, but took a similar methodology of finding the largest insurers and looking there. 7 had relevant coverage policies, and 5 explicitly did not cover this type of testing, so didn't cover it for anybody in their policy. 2 had broad coverage policies for just genetic testing at large. So we will cover genetic testing, but only if it's, quote, medically necessary, and that required a pre-authorization. And the authors looked and concluded that APOE testing was unlikely to meet the criteria for medical necessity. So in general, this medical necessity piece is a really big thing to keep in mind for genetic testing or for insurance coverage. So generally, and this is outside of the genetic testing context in general, insurance policies cover things that are medically necessary. And so that is just a threshold to meet. So they may cover physical therapy, but only physical therapy that's medically necessary. They may cover surgery, but only surgery that's medically necessary. And so really what these coverage policies do is define for us what they consider medically necessary. And so sometimes those are broad, where it's here's genetic testing and what's considered medically necessary, and sometimes they're very specific, like we'll cover BRCA testing, we'll consider that medically necessary in these exact situations. But you can see here the difference between BRC1A and 2 and APOE, where there's very little coverage, insurance coverage for APOE, and quite a bit of insurance coverage for BRCA. And some of that is because of the underlying reasoning behind insurance coverage, which is we want to cover things, or insurers want to cover things that have some clinical utility, that if the individual gets that information, they will be able to do something to change treatment, to prevent the disease and all of that. And so that's why there's less coverage for something like APOE, because you can find out you have this predisposition, and that might have personal utility, but it doesn't necessarily have any medical utility because we don't have a prevention measure, as opposed to predisposition to breast cancer, where people can have screening to actually prevent disease in the future. Now, I mentioned, I promised that I was going to come to this point, but it's really important to remember that all of this is individualized. So just because the insurance policy at large has this coverage policy, it doesn't mean that every individual under that policy will be able to have insurance coverage. They have to meet that specific coverage criteria. And so they have to look at policy documents and medical policy manuals, and of course, meet deductibles and all of the other sequelae of stuff that goes along with insurance coverage at large. So next slide. So I wanted to give a couple of examples of specific policy language, just so that you all can get a sense of what's covered by insurers and how they talk about this. So this is an example of a Blue Cross Blue Shield policy, and it's their medical policy manual. So it's guidance for what's covered for some of their policies. And this is genetic testing for alpha-1 antitrypsin deficiency. And so this would be a type of medical condition that somebody may want to find out information about pre-symptomatically, so that they could take some measures to avoid toxins and things in the air. But here you'll see the language that I mentioned, that genetic testing for this deficiency may be considered medically necessary. So here they're defining what's medically necessary. And it's when either of the following conditions are met. Either the patient is suspected of having this because of clinical risk factors, or because the patient may be at high risk due to a first-degree relative. And so here's where this family history piece really comes in. And this is going to mirror a lot of what Lori mentioned in her talk about the screening guidance, really specifically pinpointing family history as helping us to understand when somebody should be screened. And the insurance companies look to those screening guidelines to see whether or not something is medically necessary. And so this is going to mirror a lot. But so basically under one, the person either has to have clinical symptoms or a first-degree relative family history, or number two, have other clinical symptoms. And then you'll see at the bottom, genetic testing is considered investigational in all other situations. And if something is investigational, there's not going to be insurance coverage for it. So just to give us another example to look at, here is a Cigna medical coverage policy for hereditary cancer susceptibility syndromes. So this is looking at, they have a whole thing for all of their hereditary cancer susceptibility syndromes. And I just pulled out one for retinoblastoma. And this is considered medically necessary when the individual meets these following criteria. And again, you'll see the first one is that they are at risk with a family, or they're an at-risk individual because of the family, a family member has that variant. So a family member has to have tested positive for that RB1 gene. There's clinical symptoms like bilateral retinoblastoma, or there can be a combination of the two, where if you have some clinical symptoms along with a family history of the disease, then testing is considered medically necessary. So again, common theme, either clinical symptoms or family medical history that makes you at risk, or some combination of both. Next slide. And then, as I mentioned, so the first two examples I gave are policies that had language specific for one particular type of genetic condition. But what insurance companies will also do is have a policy that's just broad for genetic testing in general. So this is some example language that Aetna has. They call their policy manuals clinical policy bulletins, and this is for genetic testing at large. So Aetna considers genetic testing medically necessary when all of the following are met. Either clinical features or at a direct risk of inheriting the mutation in question. Again, this idea that maybe a family member, direct inline family member, has to have tested positive for a particular mutation or particular variant. And then we see this theme that the result of the test will have to directly impact the treatment. So it can't just be for informational knowledge, it has to be able to affect somebody's treatment in some way. And then a couple other pieces. But in the last piece is that disease-specific criteria has to be met. And so even within the broader genetic testing, if there's a disease-specific criteria, you also have to meet this. Next slide. So some of the key takeaways from this is, of course, coverage determinations are going to be really specific to the type of insurance coverage somebody has, whether they have a private plan. Private plans might be more generous than, some might be more generous than others. In general, the rule that insurers look to is whether or not something is medically necessary. And medically necessary can be specifically defined by a genetic condition or genetic test itself. And as I mentioned, often with reference to either clinical symptoms or the family history or that combination. And so this is, of course, really problematic for those who are adopted who may not know their family history. So they are most likely to get coverage for genetic testing once symptoms have already developed. This makes me think of what Lisa was talking about, where she herself mentioned, and thank you, Lisa, for sharing your personal experience, but mentioning, I don't really need to know about that predictive side, but if it were medically necessary, then I would consider getting testing in that situation. And so if for somebody like Lisa, insurance coverage really maps onto that view, right? That they would cover it if it were something about symptoms that happened. But for somebody who wants to learn more because they don't know the family history, insurance won't necessarily cover that because they see it more as investigational or exploratory, which generally isn't covered by insurance, as opposed to being something that's actually medically necessary, because that's our overall bar. Next slide. So that is all I have, and I'm happy to continue the discussion after our break and in the breakout rooms. So thank you so much for having me.